We all know the teenage years can be a roller coaster, right? But for some teens, the emotional storms are way more intense, way more frequent, and honestly, way more damaging than just your typical growing pains. Today, we're going to dive into a really complex and often misunderstood condition: borderline personality disorder in adolescence.
So, this is the big question, isn't it? How do we tell the difference? Is this just a phase they'll grow out of, or is it a serious pattern that really needs our attention? Well, yeah, a lot of teens are moody and their friendships can be dramatic. BPD is on a whole other level. It's about the sheer intensity and the way these patterns just take over a young person's entire life.
Okay, let's break this down side by side, because this is where it gets really clear. A typical teen might have a blow-up, but they usually cool down and get back to normal. With BPD, a tiny little trigger can launch a full-blown crisis that goes on for hours. Friendships don't just shift, they swing wildly from "you're the best person in the world" to "I hate you, you're the worst." And sure, all teens hate being rejected, but for someone with BPD, there's this terrifying fear of being abandoned that can drive them to do some really desperate things.
This analogy right here, it gets to the very heart of what it feels like. What might be a little social bump for you or me can feel like an absolutely excruciating injury to someone with BPD. This extreme emotional sensitivity is a core feature. The slightest hint of criticism or rejection can trigger just overwhelming, unimaginable pain.
So we can see the symptoms on the outside, but what's actually driving them? Let's peel back the layers and really unpack the why behind all this instability.
So here's the official clinical definition. And the key word to latch onto here is pervasive. This isn't just something that happens at school or only at home. It's a pattern of instability that seeps into everything: how you see yourself, how you feel from one moment to the next, how you act on impulse, and how you try to connect with other people.
It all starts with this first pillar: intense emotions. We're talking about emotional dysregulation. That means their feelings can spike from 0 to 100 in a split second, like an emotional roller coaster that's completely off the rails. And getting back down to a calm state can take a really, really long time.
Paired with that is the second pillar, a really unstable sense of self. Now, all teens are trying to figure out who they are, but this is so much deeper. It's this constant, painful confusion about your own values, your goals, who your friends are, even who you are at your core. This often leads to this chronic feeling of emptiness inside, like a key part of you is just missing.
And then, kind of holding all this chaos together, is the third pillar, this deep, powerful fear of being left alone. This fear is so intense that it's what drives a lot of the impulsive and frantic behaviors we see. It's all a desperate scramble that keeps people from leaving, whether that threat is real or just imagined.
Okay, so this is already a really volatile mix. Now, what happens when you pour gasoline on that fire? Let's talk about the connection between BPD and substance use, because this often creates a truly dangerous feedback loop.
Now get ready for this number, because it is absolutely staggering. The lifetime prevalence of a substance use disorder in people with BPD can be as high as 75%. Let that sink in. 3 out of 4. That tells us these two things aren't just related, they are profoundly tangled together.
So how does this vicious cycle actually work? Well, it starts with that overwhelming pain from BPD, the emptiness, the rage, the anxiety. To cope, a teen might turn to substances to try and numb it all out. And for a little while, it works. But in the long run, the substance use and the withdrawal actually make the BPD symptoms worse. The mood swings get more extreme, the impulsivity gets more dangerous, and of course, that just makes the original pain even more intense, and the whole terrible cycle starts all over again.
This quote just nails the terrible irony of it all. The very thing they're using as a solution ends up becoming a huge part of the problem. It's a tragic trap where the attempt to feel better ultimately makes things so much worse.
But this condition doesn't look the same in everybody. In fact, there's another layer of complexity here. Gender can actually have a huge impact on how BPD symptoms show up, and that can sometimes lead doctors right down the wrong path to a misdiagnosis.
Okay, so the key difference often comes down to this idea of externalizing versus internalizing behaviors. Think of it as acting out versus acting in. Teenage boys with BPD are often more likely to show that pain outwardly through aggression, getting into trouble, and substance use. So they might get misdiagnosed with something like conduct disorder. Teenage girls, on the other hand, are often more likely to turn that pain inward through things like self-harm, depression, or eating disorders. This can lead to them being diagnosed with just depression or an anxiety disorder, completely missing the bigger picture.
And this is the single most important takeaway here. Even though the behaviors on the outside look totally different, a fistfight versus a secret struggle with self-harm, they can both be fueled by the exact same underlying emotional agony. It's a powerful reminder to always look past the symptom to find the source of the suffering.
So I know, with all this complexity and pain, things can sound pretty bleak. But I want to shift gears because this is the most critical part of this whole conversation. There is hope. There is absolutely a path toward healing and stability. There is a very effective, scientifically backed treatment that was literally designed for borderline personality disorder. It's called dialectical behavior therapy, or DBT for short. It is considered the absolute gold standard, and it's been proven time and time again to help people reduce their symptoms and dramatically improve their lives.
DBT is super practical. It's all about teaching 4 sets of crucial life skills. You've got mindfulness to help stay grounded in the present moment, distress tolerance to get through a crisis without making it worse, emotion regulation to manage those intense feelings, and interpersonal effectiveness to build healthier relationships. It's like a toolkit for life. And the message here is one of profound hope. BPD is not a life sentence. It is treatable. With the right therapy and the right support, teens can absolutely learn the skills they need to manage their emotions, navigate their relationships, and, in the powerful words of DBT's founder, Marshall Linehan, build a life they actually experience as worth living.
And that leaves us with one last thought. So much of BPD comes from a place of deep, deep emotional pain. The behaviors we see on the surface, they're really just attempts to cope with that pain. So what if we, as a society, as family, as friends, can really try to understand the root of that suffering? Maybe, just maybe, that's the first and most powerful step toward changing the pattern for good.